Getting old isn't much fun, but as my father, who's nearly 98, says, it's better than the alternative. Conditions like heart disease, arthritis and frailty all become much more common as we get older. And of course, many of us are living much longer than before. We all want to live long, healthy lives, so what can we do to try and improve our chances of doing this? There was a recent paper in the British Medical Journal that studied a large group of civil servants in London. It looked specifically at the association between having multiple health problems in middle age and the risk of developing dementia. The health problems included things like heart disease, high blood pressure, depression and arthritis. The study showed that if you have 2 or more chronic health conditions, you're over twice as likely to develop dementia in later life. If you have these conditions in your mid-50s, it increases the risk of dementia by 18%. The authors said that the results highlight the role of prevention and management of chronic diseases over the course of adulthood to mitigate adverse outcomes in old age. Well, what's this got to do with hip surgery? The study showed that arthritis is one of the chronic illnesses that increases the risk of developing dementia. There have been other studies that have shown a similar association. It doesn't mean that arthritis causes dementia, but if you have a painful hip, it does have a big impact on all aspects of your life. Walking's painful, so you don't do it as much. You might put on a bit of weight, drink a bit more booze and generally become less fit. You don't sleep very well and maybe you get a bit depressed. All of these things increase the risk of developing high blood pressure, diabetes and even having a fall. These conditions increase the risk of inflammation, which seems to be associated with developing dementia. You can see where this is going, can't you? When I was a trainee surgeon, we used to advise people to put off having hip surgery for as long as possible because we didn't want the hip to wear out and have to be done again. The materials and techniques that we use these days are a world away from what was done then. Of course, surgery has a risk of complications, some of which can be life-threatening, but a well-done hip replacement using a proven design has an 80 to 90% chance of lasting 20 or more years. Being free of pain, staying fit and active and mobile are all really important in helping to combat the effects of chronic health problems such as high blood pressure, heart disease and diabetes. A hip replacement might even help you to reduce the risk of developing dementia in later life. Does this mean you should rush into having hip surgery as soon as you start to have symptoms? Certainly not. The best thing to do is get a diagnosis and discuss with your doctor what the best plan for you is based on your age, health and expectations. You might be advised to lose weight, get a bit more active and take painkillers. If that doesn't work after a few months, then surgery might be the answer, and that's when you need to see an expert hip surgeon who will help you to make the right decision. You know it makes sense. If you'd like more information, please get in touch. The details are below. Thanks for watching. See you next time.